안녕하세요.こんにちは。BBクリニックの美魔女のドクタービョンです。どんなお顔のお悩みも綺麗に解決してあげます。今日は本当すごいスペシャルゲストをお招きしております。イギリスでプチ整形とか注射系の中ですっごく有名な先生のドクターマリコをお招きしました。今ヨーロッパで流行っているいろんな製剤のこと、その中でゴーリということについて話をしようとしてます。マリコ先生はイギリスでヒアルロン酸とか糸リフトだけではなくゴーリなどの注射、いろんなスキンブースター、私とほぼ同じの感覚でやっているすごく有名な先生です。私と一緒に今年の2月イムカスパリで一緒に講演したことがあります。来年も2月する予定です。ヨーロッパだけではなく中東アジア、東南アジア、アメリカとか、私ともほぼ同じにゴーリ、糸リフト、ヒアルロン酸、スキンブースターなどの講演をいろんな国で行っております。いろんな論文も書いて、美容の雑誌などにも研究した結果、ケースリポートなどを出しているすっごく有名な先生でございます。
Thanks so very much, Dr. This was such an amazing and elaborate introduction. I'm really humbled for all this hospitality by you and at your clinic. I'm really happy and honored to be here, and also I'm happy to be a part of the same team as Gouri and be a part of such an amazing team, not only a team but also an amazing product to back us with.
ドクターマリコは今回日本に来てゴーリのことを含めてアンチエイジングのヨーロッパのトレンドなどを講演を行って、今日は BB クリニックに一緒に YouTube を撮るためにいらっしゃいました。
Thank you so very much. Thank you so much. I'm again humbled and honored, and it's not only just an element of me coming here, it's also sharing the ideas and sharing your experiences along with us as well, and learning from your expertise as well, and also sharing what I have had in my experience here, so we can actually develop it further.
今日私がドクターマリコと話したいことに対してまとめますね。一つ目はヨーロッパで最近どんなトレンドが流行っているか、どんな製剤などが人気になっているか、その結果とかその理由などのことについて話したいです。二つ目は私がよく使っている製剤、ドクターマリコも使っているから、いろんな製剤のメリットデメリット、どんな人に適用するかということに対してディスカッションしたいですね。今ヨーロッパで最近のトレンドのことについて聞きたいですけど、一つ目はレーザー、スキンブースター。
Yes, first of all, the trends have recently changed, and I think it's dramatically changed over the last couple of years especially. It's moving from lasers to, and also the fillers, to actually skin boosting treatments now. So the trends are slightly evolving. So they still have got their space, but their space is slightly different than what it used to be. Before, people did not have other options, did not have modalities of anti-aging, modality of collagenesis, which is now really fastly developing. And as there are more trials behind it, as there are more experiences behind it, I think that is taking over the element of just filling and masking. So people used to just mask the problems or mask the issues by putting a filler on. So filler, as you know, is not a treatment, is not the actual solution to the root cause of an issue. The skin boosters on the other side, or the collagenesis element of these new products, is actually really good because that is reversing the effect of aging. And that is why I think there is a bit of a dramatic paradigm shift. And that shift is going from just using fillers to now going and adding biostimulators and new modalities of skin, anti-aging skin treatments. So I think that is one part. The other part is this, that anything that needs to be corrected has to be corrected from base, foundation, and then go to the surface. So for example, collagenesis happens at the dermis level, and the dermis level starts producing collagen, and then thickening of the skin will occur, and then eventually the lasers, which will be the surface treatments, will come into play as well.
最近のトレンドの中でコラゲンスティミュレーターというのが流行っているのはヨーロッパも同じトレンドですね。日本 本も韓国もコラーゲン再生を刺激するコラーゲンスティミュレーターなどが流行っています。今ヨーロッパも同じ感じにただのヒアルロン酸とか普通のスキンブースターの中でヒアルロン酸が入って潤い感じになることだけではなく肌育という概念でやっていること、つまり若い時に戻すアンチエイジングの目的でコラーゲン再生を刺激する注射剤をよく使うことにトレンドが変わっているということです。
I do agree with you in the fact that HA skin boosters are basically only for attracting the water content, and it just causes the moisturization or the hydration of the skin, which is again a very good thing. But one, it's very short-lived, and two, there's no collagenesis. There's no collagen induction. So the collagen induction is only caused by stimulating the fibroblasts, and that only occurs by actual biostimulating agents, which we need to look at, and we need to be involving into the treatments for long-term collagenic effects. So I think that is where it's still above the HA boosters. Yeah.
エイジングプロセスのことについて大きく2つがあるじゃないですか。ボリュームロス、実際重力の方向に垂れてしまうということですね。ボリュームが減ってくることに対して日本では最近トレンドがボリュームを補うためするのはヒアルロン酸と脂肪移植などがあります。今ヨーロッパではボリュームを補うため入れる施術としては何が流行ってますか？
The predominant trend in last decade or so has been the fillers. But then what happened, as I said, that there has been a paradigm shift, and the shift is this: basically more and more when people have trialed fillers for a while, now they are also recognizing the limitations of it. And also the fact that you're not really doing any good to yourself in terms of collagen. So you're getting older anyways, the effect is still there. So I think for volumization, depending on how much volume is required, it can be varied. So for example, if somebody wants to kind of prevent themselves to go to a position where they need more and more fillers, then they should start with biostimulators by 30s, I think, end of 28 years or 29 years, something like that. They can start with something which causes collagenesis. Now, on the other hand, if somebody has lost a lot of volume, then for instant lifting or something, then you might need threads, you might need fillers, you might need a combination of few things. It might not just be one modality that would work for everything. So it's a very individual thing, what suits for a certain client. Especially the clients who are a bit more middle-aged and want to age gracefully would rather prefer natural-based treatments where collagen-based treatments come into play. But on the other hand, if there's a younger client, they might, especially in European trend, they might actually want to have fillers to extremely volumize in certain areas. So it depends on the patient and client's preferability and the suitability. And one client is age of the client and the fact where they're coming from and what their requirements are. Somebody could be losing the volume generally due to the fat depletion, due to the fat resorption and the bone resorption. So that needs to have much more treatments done, as you rightly said, as compared to just the collagenesis in terms of the skin boosters and stuff.
ヨーロッパの患者さんの場合はボリュームロスがどんな形に来るかということと、特にドクターマリコのクライアントの中で輪郭の方がへこんでそれを治すために来る方いますか？
Yes, we do, and we do have these sorts of patients, but as the most common and most noticeable effect of aging is normally towards the mid and lower face. So that's the cheek and the lower face, and the sagging of the skin occurs in this area, which causes the jowling as well. Also, the skin type also plays a factor in this as well, because the European skin type actually is not very used to skin exposure. They don't age well. Fairer the skin, it does not age really well as well. And then lack of certain elements as well, like there is a lot more prevalent vitamin D deficiency in that part of area as well. So those factors also play a part. The less sun exposure, but then their skin is not designed to be exposed much as well. In Europe overall, what I've realized is that the aging is not as good as, so the mid face and lower face is something that we need to start working on around about mid 30s, and that's something that I've noticed in that trend.
アジア人とヨーロッパ人はやっぱり老化の形とか違うと思いますね。日本人とか韓国人などのアジア人の場合はやっぱり へこみが発生したり、弾力は年をとってもヨーロッパ人よりはある感じですね。だけどヨーロッパ人の場合はボリュームが減ることで悩むことより垂れてしまうことがありますので、中央顔面部とか下の下顔面部のところのたるみが発生するから、たるみのことについて悩みが若い時からありますね。だからそれを改善することがヨーロッパのお客さんの中では多いと思うし、そのニーズが多いから、それに対しての治療することを主にやっていると思いますね。日本の場合は今流行っているのはデバイスを使ってリフトアップすることもすごく流行ってますね。もちろん糸リフトも流行っているんですけど、日本人の場合は控えめでなるべくダウンタイムがあることは避けたいなという傾向があります。垂れてしまったことに対しての治療をヨーロッパではどんなことが流行っていて、特にドクターマリックはどんな治療が好きですか？
So I personally really like threads as well. So I do think that it's one of the only treatments in non-surgical facelift that is immediately effective and also is a corrective treatment as well, because it caters to the sagging of the skin really well, caters to the sagging of jowling and the nasolabial and the marionettes that are being formed. It brings back the volume back to the cheeks and helps with the under eye hollowness as well. So that whole lifting effect you can achieve with the threads, but its combination with biostimulators and threads is actually one of the best modalities I have come across and that I love to do, and most of my clients are on that pathway. Absolutely good to know that, you know, to come from you that you also agree with that modality, because I do feel that that is actually a corrective way and also something that gives a good foundation for every other treatment to be done afterwards.
いろんな刺激剤があるとは思いますけど、最近ヨーロッパで流行っているコラーゲン刺激剤のことについて話していただけますか？
There are few brands that have got their mark in the market at the moment. So like Sculptra is there, Radius is there, Elance is there, and they all have got their own advantages and disadvantages, and people are using them successfully. And I think in European market, these would be the three names along with Gouri, which is something that we are using as well. And they all differ in different ways, and they all have got some advantages over each other that can be discussed. But yes, these are the normal modalities that we're using here.
What's your favorite procedure for collagen stimulator?
So for collagen stimulation, my favorite is Gouri. So Gouri is because it's based on PCL, and along the classification of synthetic biostimulators, this polymer comes in the 4th generation. So after PGA, PDO, PLLA, then PCL, and PCL has got the most sustained and most highest index of collagenesis, and that is why I think I like PCL, liquid PCL, and the Gouri is my favorite.
PCL 製剤の中で僕は使っているのはエランセラ、ピューレン、イニブラン、3種類の PCL フィラーがありますけど、 PCL フィラーとゴーリの使い分けのことについて話してもらえますか？
So the main difference is the CMC gel, so the particle aspect of it. So basically, when we say fully liquidized, what we have managed to do is completely eradicate the particles. Usually the injectables are based on CMC gel, which is carboxymethyl-cellulose, and that particle aspect is usually the cause of granulation and also the occlusion of the vessels. And this is where Gouri has nailed it right on the head, that actually there is no CMC gel, so no particles, so no granulation and no aspect of vascular occlusion, and that within itself increases the safety profile of the product. And not only that, then it comes to the fact that if you're getting the highest level of collagenesis along with the safety profile, that really is a winner for me.
ゴーリと糸を一緒にするとき、同時にしますか、それとも少し間隔を空けてしますか？
So there is no hard and fast rule for that, and there is no guideline for that, but it's something that we can use within our rules of the aesthetic procedures. For example, I personally like to do the threads first and give it a bit of a gap of a few days, like 2 to 3 days, and then I do Gouri afterwards. Now, depending on this question was asked before as well. So depending on some clients, for example, if you're doing threads and you ended up having a little bit of a extra bleed or a bit of a hematoma, then you would give a bit more of a gap until that completely resolves, and then you do the next step. If you are an expert and you want to, you can even do it on the same session as well. I personally like the thread first and the Gouri after, because I feel it makes a bit more sense for the fact that, I bring the lifting effect and then I cement it with the Gouri. So lift first and then cement it with the Gouri collagenesis. So that's what I like personally.
何日間空けてすると言ってるけど、僕の場合は1ヶ月以上空けてすることが好みなんですね。糸リフトするとすごく上がることもありますけど、糸リフトの効果が少し馴染んできて、もう少し上がってほしいなという時合流すると、また引き締めの効果も出てきて上がるということで、満足度も高くなるし、糸リフトの効果が長く持続する効果もありますのでいいです。リスクとしては、糸リフトをやってすぐ合流すると内出血が長くなる恐れがありますので、分けてした方が安全だと思いますね。1ヶ月以上空けてした方が個人的にはおすすめでございます。
I agree. I do agree. And that is also one of the reasons why I would normally put a bit of a gap between the two treatments. But it's nice to know that, you also think in the similar fashion that doing threads first and then Gouri followed by the threads, and that's a good approach.
ハイプとか高シワなどのトレンドはいかがですか？ 2010年の前の場合、スキンブースターがあんまりなかったからオペとかしてて、この後ヒアルロン酸が少しすることになって、デバイスとしてはウルセラとかサマクロなどがどんどん流行ってきたんですけど、2010年代からスキンブースターがいろんな製剤が出てきたんですね。その中でスパルツラも2010年代に登場して、その後いろんなスキンブースターなどが出てきて、肌を改善することだけではなく、新品の環境を若い時に戻すコラゲン刺激剤などが出てきて、リフトアップすることにはなったんですけど、今ヨーロッパのトレンド、スキンブースター、バイオスティミュレーター、ハイフとか高シワなどのデバイス、それを見てみたらどんなトレンドになっているかというのが気になりますけど。
The current trend does combine all these three in some ways or the others. And in Europe, the thing is that it also depends on what kind of practitioner people are going to. Not everybody is like you, Dr. Bion, who is doing threads. Like, that there are a lot of estheticians who wouldn't even touch threads and wouldn't even try to do threads. So if they can't do threads, they won't offer threads. So that's not going to be a part of their offering. So similarly, in terms of biostimulators and in terms of skin boosters, now skin boosters are offered by almost everybody because they're easy to do. They do not have much of a complication aspect to them. So they're easy to do. So everyone is offering that part, especially in Europe and UK's market. And unfortunately in UK market, even some of the non-medical people are doing it as well. So that's what complicates the trends over there.
Yeah.
So because the trends are driven by the practitioners. The practitioners are offering things sometimes which are not necessarily the right direction as well. But when you are dealing with non-medical people, then they are actually sometimes offering things which are not the most appropriate treatment for the client. But generally speaking about it, I think every one of these modalities have got their own space in terms of treatment. You need to plan according to the need of the client. And then how I approach is this, that I go from deep to shallow. So what I do is I go deeper, make the foundation of the skin, then I start coming to the surface. So for example, skin booster or a facial would be my end treatment after I've done the groundwork. Not something that I would start doing from the first day. Do you get it? So for example, if there is a wall that needs to be fixed, I would not paint it first. I would do the cement and the bricks first, and then I will do the plaster and the paint. If I start painting on a wall that does not have the bricks, does not have the cement, then I am not really doing the right job. So I think it's the approach, how you approach a face and skin and the modalities of aging as well. This is where I, as a trainer, am also trying to, in my trainings, to train to my students in the right way and give them the right direction what to do. Yes, the trends are at the moment, the boosters are very easy to do, so everybody is doing the boosters. In terms of collagenesis aspect, now it's a big trend as well. So people are trialing them. Sculptra is being trialed, Radius, as you said, Elance, as you said. But they all, as I was earlier mentioning, that have got their own limitations to them. So depends on which area, what kind of esthetician we are approaching, what you're going to get out of that. I hope you agree with that, isn't it?
my appreciation for the client really same to you.
Oh, bless.
Yeah.
Thank you.
今日はドクターマリフと一緒に今ヨーロッパで流行っているコラゲンスティミュレーター、スキンブースターなどのことについてお話しいたしました。今日の動画が気に入ったらチャンネル登録とグッドボタンよろしくお願いします。私のインスタグラムドクタービョンのフォローもよろしくお願いします。誰もわからないように綺麗にしてあります。見ましょう。見ましょう。